Hi, everyone. Welcome to the last session of the year of the Disability Innovation Live webinar series. Today's session is about race, disability, and innovation. And we have an amazing set of panelists presenting today. I will just share my screen so you can see the presentation that we have prepared. Thank you, everyone, for joining. So today's session is about race, disability and innovation, diversity and the disability innovation movement. We have available closed captions and British Sign Language interpretation. To turn on the closed captions, they should be turned on, but let us know if they're not working. You can do this by gallery view next to the green bar at the top of the screen and then click view options menu and select view side by side. This is only available desktop only, so if you're connecting from a mobile device, and we suggest that you change to a desktop if possible. We will have a questions and a Q&A session, and this session will be recorded. We will upload it to YouTube, and we will have a transcript available. So about this series of events that we do, the Disability Innovation Live series, is about sharing knowledge and experiences in disability innovation. We want to know the stories behind the innovations, the people behind the products, and it's an informal space for ideas and reflections. And all feedback is welcome, as always. About the Global Disability Innovation Hub, we're a research and practice center driving disability innovation for a fairer world. We were born out of the legacy of the 2012 Paralympic Games, and we're a community interest company and academic research center based at UCL. We currently have programs in 25 countries, and we are working to reach 15 million people by 2022. So our set of panelists today, we have Iyola Olafinan, who is a board member of the GDI Hub. We have Kanodia, also a board member and disability champion. We have Paul Entulila, assistant project manager and GDI Hub staff member. And we have Crystal Emery joining from the US. It's the morning for her. And she's the CEO and founder of URU, the Right to Be Inc. So an amazing set of panelists, and we're really excited about this topic, which we think it's very timely to discuss. And just an introduction of what we'll be discussing this session is the intersectionality between race and disability. And we see the intersectionality of being the interplay of different social identities, so how the identity related to disability and the identity related to race can interconnect to either create more barriers, and how these identities defined as barriers, and how can we overcome these barriers from employment to entrepreneurship, education to aspirations. We will be asking what's next to make the disability innovation space more inclusive, and exploring why diversity is critical to innovation. And this exploration of race and disability is relatively new for the GDI Hub. So we're really looking forward to what the panelists will be sharing with us, but also of the audience and your views and questions. So we will start now with Kanodia. So Kush, if you could turn on your camera and audio.
Hi, thank you, Rosa. Thank you for the GDI Hub for giving me the opportunity to speak today. So I have a lived experience of being a BAME disabled person, and I was actually a torchbearer for the Paralympics. And I think that really shows a good example of how empowering disabled people can lead to innovation. So I wanted to talk about the No Wheelchair Tax campaign that I created, that was basically a campaign to abolish all disabled car parking charges in all NHS hospitals. in England. So the first bullet point, I'll read out the slide as well, that we were published in the Times, the Telegraph, the Daily Mail, Disability News Service twice, and we interviewed with BBC London Radio. And we actually managed to get the campaign into the manifestos in the 2019 election, UK elections, for both the Labour Party and the Conservative Party. So that was like a real great achievement. And then we actually also got agreement from the Liberal Democrats as well, because we were working with MPs from all the main political parties, from Marsha Dakova of Labour to Robert Halfon of the Conservatives, to Vince Cable of the Liberal Democrats. So that was real kind of transformative systems change. So the second bullet point was that we managed to abolish all disabled car parking charges in 206 NHS hospitals in England. And this helps 2.5 million disabled people to access critical healthcare in the NHS. And I wanted to thank the Global Disability Innovation Hub and Lord Chris Holmes for their support, because they provided key support for the campaign. And basically, London went into lockdown yesterday. We know that COVID-19 has disproportionately impacted disabled people. We know that only 26% of our tube stations are accessible, and there's a higher risk of contracting COVID-19 from public transport. So this innovation, this systems change, will actually help to save disabled people's lives and provide access to critical healthcare. So what the Conservative Party did, they actually expanded upon my campaign, which my campaign was focused on disabled people with blue badges. They expanded it to parents of sick children, people who are long-term inpatients, and NHS night staff. So one of the things that I realized that there was going to be a supply and demand issue when it came to hospitals, when it gets implemented. So originally it was supposed to be implemented in April, and now it's going to be implemented in January in 2001. So what I realized was the only way that I can really match supply and demand was to enable the local street network. So the third point, the new campaign in a way, is to create a standardized and compassionate disabled parking policy for London, where the proposal basically is for the inner London boroughs to provide 4 hours of free parking in pay and display areas for blue badge holders. So that would be for the inner London boroughs of the Royal Borough of Kensington and Chelsea, the City of Westminster, the City of London, and parts of Camden. And then for the outer London boroughs, the remaining 29 boroughs, to provide free disabled parking. So that would create systems change in London. And the 4 hours is actually the same statutory target for waiting times for A&E. So this would provide access to critical goods and services for disabled people in the time of a pandemic and lockdown. So I believe this is really kind of critical change. And we've already actually managed to get the Royal Borough of Kensington and Chelsea to create systems change. So they actually did a 6-week public consultation in the beginning of the summer where they received no objections, and they implemented the change in September. What they did was they created hospital wards. So they created 3 hospital wards around Chelsea, Westminster, the Royal Brompton, which is our speciality cardiology unit, the Royal Marsden, which is our speciality cancer unit, and St. Charles Hospital. And so now I'm basically trying to create a campaign for systems change across the whole of London. So I've been fortunate to have additional supporters from the Royal Borough of Kensington and Chelsea recently, to Sean Bailey, who's the Conservative Mayor candidate for London, Nikki Aitken, who's the MP for the Conservative MP for City of London and Westminster, and lots of disabled people's organisations from Action for Disability, Kensington and Chelsea, Westminster, to City of London Access Group, Inclusion London, Disability Rights UK, and now we're in discussions with the Lib Dem candidate and the Green Party candidate. So basically what my call is now, as I'm calling on all London councils and political parties to immediately support the campaign in their election manifestos for the London mayor elections in May 2021, so we can make London the most accessible city in the world. And then we can replicate the same systems change in all councils in England and the UK. Thank you very much.
Thank you, Kush. Thank you for that presentation. And what I really liked about what you mentioned is just the importance of campaigning and connecting the campaigning with policy changes, and how a campaign that started with specific scope then grew to cover more people. So it clearly goes with accessibility being best for everyone. And the other point that I thought was quite interesting is that you mentioned trying to position London as the most accessible city in the world, and that's something that goes very well with the Paralympic legacy and with the torch that you were carrying a few years ago. And thank you for that presentation. We will also pick up on what you mentioned of the relation with COVID-19 in the questions, but right now we will go with the second speaker, and the second speaker is my colleague Paul Ntulila. He's the assistant project manager at the GDI Hub, and he will be covering different topics around the work that he has been doing in the past few months. So over to you, Paul. If you could turn on your camera and your audio.
Interpreter, you're muted.
Ah, my apologies. Hello, can everybody hear me? Hi, everybody. Thank you, Rosa, for passing over to me. I'll begin my presentation now.
Thank you.
So this is, if we just want to go on to my slides. Ah, perfect. Bear with me. Can we see Paul? Is Paul's camera on? Sorry, can everybody see Paul?
Yes, we can see Paul.
Yeah.
If you're going to ask Paul to unmute, it will just make sure the audience can see him too.
Okay, yep, fine. Okay, great. Okay, perfect. Hi, everybody. Hello. Thank you for coming and joining us to the presentation today. So recently, this is something I've been working on. I've been working on a project with GDI Hub since National Inclusion Week in September 2020. And we were looking at Black disabled innovation and exploring why that's so important and how we can get diversity into that. And so we were exploring questions around that, and I was interviewing people and talking to people whose backgrounds were working in this area, whose shared life experiences were in this area as well. And we were looking at the challenges and things that they'd experienced through their life because of this, and how that had affected innovation and the discrimination that they'd felt. So also we were looking about how they'd influenced others and how this information could be used. So especially like Black innovators, and how this could be used as an example for the community in the UK and globally. So our GDI Hub, of course, focuses on, the other one. Yeah, looking at how it could work through YouTube and globally. And so we want accessible presence there too. Sorry, bear with me. Can we go on to the next slide? Okay, so this is connected to good leadership and making a difference to diverse innovation. So there was a vlog that went viral. This was a little bit ago, and it was about the effect on people on yeah, it was on how Black Lives Matter happened and the effect that this had on people that are intersectional, and how leadership can make a difference on that. So I just wanted to share that with you at the moment. That can have a massive effect, especially in employment and in the workplace, because there's a double discrimination there, and it's about feeling safe and also having somewhere to express that feeling, being comfortable enough to talk about and express my experience and what's happening to me, and being able to have a safe space to do that with Black colleagues or people that understand the same experience. And I think leadership have a great responsibility in empathizing and working with people and understanding that. And that makes a massive difference in how we move on and make sure that we're all included and we are working together to remove the barriers for a more inclusive future. Can we move on to the next slide? Now, it's very difficult to focus on setting something up because we want to make sure that workplaces are inclusive, but without being tokenistic. So we want to make sure that we're working together with the Black community and with different cultures to have everybody included in that, and making sure that we're working towards something really smoothly and collaboratively. The opportunities for the Black community within innovation really need to be improved, because at this point that there isn't any equity, there aren't the same opportunities offered. So moving forward, for disabled Black innovators, we need to be creating those opportunities and removing those barriers and encouraging people to improve how they are visibly making differences. It's really important that there are scholarships and training opportunities provided so that this disadvantage is removed, and there's just this leveling up the playing field. We need to grow the skills within that community, so we can be more visible and show people that you can get through and the barriers there can be removed. Next slide, please. That's it. Thank you.
Thank you, Paul. Thank you. And Paul and I, we've been working together in these topics. And I remember when you first proposed the blog that you mentioned, we were discussing how to best convey the messages that relate to disability, race, but also about leadership, which is a great connection as well. And the format of the blog was the first that we did at the GDI Hub of having, instead of a written blog, a video blog, and that was quite powerful. And it was in BSL, so quite touching and moving. So just wanted to highlight that. And something else that you mentioned that I thought was quite interesting is the need for scholarships. And the GDI Hub has been running the Snowden Trust scholarships, which help disabled leaders get into higher education in the UK, but also the need for skills development to level up the playing field. So quite important, and we can follow up that on the question session. So thank you for your presentation, Paul. And we will now have Crystal. She's joining from the US. It's really early in the US at the moment. And I'll just ask Luis to play the video that Crystal wants to show us before her chat.
You can stop sharing your screen, Rosa.
Good
Thank you,
morning.
Louise. Crystal, over to you. Thank you.
Okay, I'm Crystal Renee Emery, and I'm a filmmaker and producer, and the founder and CEO of You Are You the Right to Be. It's a nonprofit content production company that deals with social justice issues, and we utilize solutions that meet at the intersection of the arts, humanities, and science. In addition to my work at URU, I am a member of the Producers Guild of America and the New York Women in Film and Television, and I was selected as a AAAS, if then ambassador for girls in STEM. Every day I triumph over two chronic, Every day I triumph over two chronic diseases as a quadriplegic to create real and sustainable change. My physical identity lays at the intersection of race, gender, and disability. Get involved. My projects and initiatives change the narrative about marginalized and underserved, underestimated communities, and challenge to all disabled and able-bodied to engage in open and honest dialogue and leverage the power of our collective impact. I tell stories not only to arouse empathy, but to empower us all, and I mean all, to seize a future in which we are realizing our full potential. So there should be a slide. So this slide is that the 2020 emerging research in Washington, and all of these folks have some form of a disability. URU's approach to sustainable change making is multifaceted, utilizing film, print, virtual reality, and face-to-face engagement. I'm going to introduce you to three projects in particular that speak to our intersectionality and our approach to change making. In 2015, I launched a project, Changing the Face of STEM, an initiative designed to empower all students, and not just young people, to pursue careers in STEM fields, regardless of what the world deems them capable of. I really, really believe that STEM offers the greatest opportunity for people with disabilities to be fully employed. And now with the pandemic, we see that everyone is working from home. And with technology like this, where, we're being broadcast all around the world, it opens the door for us to be fully engaged. Changing the Face of STEM, my project, acknowledges the limited learning opportunities available for students with disabilities. But we can do something about that. And it starts with us. And it starts with what you're doing today. Because if you can't see it, you can't be it. So we bring students face to face with doctors and astronauts and engineers. And that photo that you're looking at, those are some amazing PhD candidates. And one of the women who is visually impaired has to go out and work in the bogs. And so how do you go out, in the mud and do that kind of work? And getting mentors to help you get through that. This is our other project, Building Bridges, the Power of the Sisterhood. Women are healers. And bringing women together, a very diverse group, and getting them to work together, creating a collective impact. For Building Bridges, the Power of the Sisterhood, we take professional women in STEM to engage in open, honest dialogue about the divide that exists between white women and women of color. Women in STEM drive innovation because these fields are not kind, welcoming spaces for women or people with disabilities or women of color. All too often, we get into survival mode, approaching our pathways to success as a competition to occupy those limited spaces. What I'm trying to get people to do is to work together. We have more power as a collective than we do as trying to address these issues separately. Building Bridges creates a dedicated space for diverse groups and courageous conversations. And we really, really need to have courageous conversations. Today is a courageous conversation. And so when you talk about, disabilities and work, and what is the perspective of people of color, we are like triple whammy. We get discriminated against because we're a woman, then we're black, then we have a disability, and time is changing. It is time for us to stand up and demand who we are and what we're capable of. Let's go down. Next slide. My most recent initiative, Our Humanity, is a prevention and education transformation. It's designed to address the disparities in COVID-19 messaging and education that exists across the lines of race and disability. The CDC recently declared racism a public health crisis, and we need to no longer walk around this. We need to look at the devastating, disproportionate impact of COVID-19 in the community of color, as well as in the community of people with disabilities. The pandemic has only exacerbated disparities in healthcare and healthcare outcomes that exist for communities of color and people with disabilities. As a person with a disability, we are far more vulnerable to the ravages of this virus. We are left to live in a constant state of uncertainty, highly aware of our vulnerability, yet rendered invisible by local, national, and global response to COVID-19. So I was really glad to see what the gentleman before his work with the bus situation. We are in the middle of rolling out Our Humanity, utilizing faith-based collaboratives. So we're working with the Pentecostal worldwide organization, which has 2.5 million members, as well as the Baptist Convention, which has about 200 chapters around the United States. I could go on about the work that URU is engaged in, but I just want to say that conversations and connections like these here today are ways so necessary for all of us to do the best work and change the world. later today, I'm moderating a panel on diversity and inclusion for Google. So I do feel like more and more we are all looking to do types of innovation, get engagement that embraces all people. I'm thrilled to be part of this panel and to hear from my fellow panelists as well. So thank you so much for inviting me. And I think it goes back to the moderator.
Thank you, Crystal. Amazing presentation. And I just want to highlight some of the things you mentioned. So you said that more power we can get as a collective than to do it separately. And we can see that across all the presentations that we've seen so far. And I'm sure with the presentation that we have left from Iola as well, and that I thought that was quite powerful. And also the fact that you mentioned that this is a courageous conversation, and I agree, because there's considerably lack of information and debate around the intersectionality of disability and race, but also the intersectionality between disability, race, and gender. So the fact that during your presentation you also highlighted that, I thought that was quite interesting, and it just opens a space for discussion and debate and actions and campaigns to look forward to in the next year or so. And really good to hear that you will have a presentation with Google today. Good luck with that. And we will now follow up the panelists, and the next presenter is Iola. Thank you, Iola. I can see your camera is on, so you can activate the microphone. It's active now, so I'll over to you now.
Hello, good afternoon, everyone. My name is Iola Olafimihon. I'm a member of the Global Disability Innovation Hub Board, Advisory Board. My conversation with you today primarily focuses on how assistive technology innovated back in Nigeria enabled me to gain a lot of independence. So I was born over 50 years ago, and I contracted polio at a very early age. So I've never really known how to walk, or how it feels for people, how it feels to walk. However, at that very early stage, my parents actually supported me to be independent. So one of the things they did was to enable me to use crutches and calipers and all that at that very early stage, to actually go to school myself, because we lived quite close to my primary school, and I was able to access education on an equal basis with my non-disabled peers. However, what will really impact my life was when I finished university and started working in the bank as a lawyer. And I didn't have any, because Nigeria, we don't have really good accessible transportation and all that. And I had to actually buy a non-accessible car and employ a driver. If you've been to Nigeria before and you know how we are there, if you have a driver that is a rascal, it might mean that sometimes you don't even have your own car to ride. Anyway, the driver eventually smashed my car, and I was even for a while carless. But what happened was, my big sister introduced me to a gentleman called Cosmas Okoli, who, a disabled man himself, found a way to innovate a very simple technology to drive an automated car. So I went to see him, and I saw, behold, that a disabled wheelchair user or a crutches user can actually drive a car in Nigeria. And the picture I have on the screen illustrates that simple mechanism, which later on, when I came to the UK, found to be very, very technical here in the UK. But back in Nigeria, that simple technology that my friend Cosmas Okoli innovated in his center actually enabled me to have more access, enabled me to attend press conferences about disability issues and rights in Nigeria, and eventually made me to actually apply to come and study here in the UK, human rights and social justice, and to learn more about how AT is improving people's lives. So my being part of Global Disability Innovation Hub is actually to also emphasize that assistive technology is actually a human right that enables people to live their life as fully as possible. That is my short presentation. Like I said, it's just to focus on how AT has enabled a disabled person like me to have freedom and independence back home in my country, Nigeria. Thank you very much.
Thank you, Yola. Really fascinating story. And I think what I really enjoyed of your presentation is how you connect with your personal trajectory, but of the also on the power of innovation in middle and low and middle income countries. And that's something that at the GDI Hub we're quite focused on. And it's part of our UK funded 80-20 program, is testing what works in low and middle income countries and how these innovations can be then scaled up. And just the fact that, as you mentioned, you said it was just a simple technology and that allowed you to drive. It's a showcase of how in many countries that we're currently working on, and in Nigeria being your example, we can find some innovations that can be replicated and can have a relevant and quite substantial impact in people's lives. And I thought that was quite important and relevant to highlight. But also how you mentioned this person that created the technology, it was a life-changing moment for you, and how that sort of open up opportunities, and that's how we connect AT as well. We see assistive technologies being products that open up opportunities for those that don't have it and need it, and those who need it the most as well. So I will now go to the Q&A session. So I prepared some questions, and the first question is, what are the biggest challenges in increasing diversity within disability innovation? And Kush, I will perhaps ask you to respond to this one, especially in the UK context. What are your views of the biggest challenges in increasing diversity within the disability innovation movement?
Thanks. So I think one of the biggest challenges I found is the aspect of confidence. So we have like a benefit system in the UK, but the benefit system is very based around an energy of fear. And I find that's very kind of difficult and restricting for disabled people to break out of. I think there's a key issue in relation to a prevalence of mental health for BAME and disabled people. And that's basically due to compounding aspects of discrimination, of intersectionality from race and disability. There's social barriers, there's attitudinal barriers in relation to racism, ableism, stigma, and that's all compounded for BAME disabled people. I find that there's a real lack of help and support for disabled people on their paths, whether that's to employment or to education or to being an entrepreneur. As we've discussed previously, there's lots of barriers to access the environments that we're in. There's a real lack of visible role models for BAME disabled people, because the truth is, if as a BAME disabled person, if I don't see similar people like myself in leadership positions, then it becomes very difficult for me to dream. It becomes very difficult for me to vision and kind of aspire to be a leader if I don't see that the system is kind of proportionally representational to society. And another key value that I find that the system, it doesn't value lived experience leadership. And I think that's really critical, and we really need to start valuing lived experience leaders. So in the disability movement, we have a mantra, nothing about us without us. And it would be really good if that mantra was adopted by the system as a whole. Thank you.
Thank you, Kush. Really interesting. And I really enjoyed how you mentioned the importance of visibility and seeing Black and minority ethnic leaders, that is fundamental to sort of create the new generation aspiring to get into positions of not only aspiring, but actually having the opportunities to get to positions of power and relevance and also in the policymaking sphere. And Paul, you worked on leadership and the aspect of leadership. So perhaps it would be good if you could let us know what you think are the biggest challenges in increasing diversity within disability innovation, and touching on the leadership bit as well.
Yes, thank you. So just in response to that, the challenges through increasing diversity, what we need really is breaking through the barriers. So that's through, I believe, education and training, maybe technology training, and developing people that know the backgrounds well, and they're prepared to be involved and to really grow and develop the skills. We need to challenge this within policymakers, and making sure that the influencers are there to make sure that we're innovating and creating policies as well that shows how we can be involved, our rights. How do we become governors? How do we become involved in these policy making decisions and influencing to integrate and make these areas, these spaces more accessible through Black people and all different identities that aren't represented, that are underrepresented. And my experience through leadership is it's really important to have those conversations, because that's how we improve, through creating an open dialogue with people and showing that we can talk about this openly and collectively. That will remove the barriers. It's through that we can break through.
Thank you, Paul. And I really want to highlight from your response the importance of opening up spaces to discuss these issues. I think that is something quite relevant. And initially, when we thought about this session, we thought of this event being that a space where we could discuss it, but also perhaps encourage other people to discuss it as well in their organizations. So now I want to perhaps ask Crystal if she wants to have a response to this question from the US perspective.
Take the camera. Yes. Yes. I think that leadership is, that each of you here is a leader in your own right, and that we have to become more visible, because in order for the next generation to be able to move forward, they have to see us. But also for the current power structure, they have to see us and understand that we are capable. That's why I made that little clip that says, we are talented, we are creative, we are innovators. I mean, think about, each of us dealing with whatever our disability is. We have to work harder than most people. We have to think outside the box, what most people take for granted. And I always tell people that also makes us great employees, because we don't just settle for mediocrity. We always have to be at our best. And so I think that we make great employees. I think that, as leaders, we demonstrate our truth. And so it's really important that we as a collective make sure that we are out there where all people can see us, so that we become the norm and not the exception. And I just think it's really important that whatever platform we can utilize to demonstrate our capableness, that other leaders will then look to us for answers and that we are role models for the next generation, that they can understand you can be anything you want to. So those are my thoughts. Namaskar.
Thank you, Crystal. And really, really inspiring response. And something that I really liked of what you said is just the fact that you said we are great employees. That's absolutely like that, but you're also great innovators because you have the capacity, as you mentioned, to think outside the box, and you're always at your best. So that we've seen in our programs that translates into amazing innovations that sometimes they don't get the attention that they deserve. So how do we find these innovations and make them visible, as you mentioned as well? So Yola, just wanted to ask you if you wanted to respond to this question as well. We have more questions, so you're free to pass from this one if you want.
What are the biggest challenges? For me, one of the biggest challenge to increasing diversity is probably education. You know, primarily the education system all over the world has excluded disabled people, especially Black and minority ethnic group disabled people, from accessing that quality, same level kind of education. And I think with what GDI is doing across the globe is actually not only scaling out the education, but actually so education and also finances. So if you don't have the quality kind of education that can allow you to be innovative in thinking, then it's difficult to break through that barrier. And then funding, especially in African countries where now the GDI Hub is actually funding innovative projects where money will be difficult for most people to access. So for me, that's primarily what I think are the biggest challenges: the lack of good equal education historically, and then funding for those who want to be innovative back home in Africa or the global South. Thank you.
Thank you, Yola. Yes, very, very important. And that relates as well to what Paul mentioned about the education and the skills gap and how to foster skills development and quality education. But I also wanted to highlight how you mentioned the funding, and we see that as being quite important in the UK funded 80/20 program that we run. And we have an example in the accelerator, the assisted technology accelerator that we run in Kenya, where that we sort of help to grow businesses that are just starting and need that process of being part of an accelerator that can help that business idea to thrive. And that's quite important, and it will be good to see more funding opportunities for innovators, not only in Africa, but in other regions of the world as well. So I'll move on to the next question, which is, how can the disability innovation community best support and learn from social movements such as Black Lives Matter? And I will ask Paul to start with this because you mentioned it during your presentation. So what are your opinions on this question?
Yeah, thank you. In response to the Black Lives Matter movement, I think it's really important that we learn how to ask them people, the disabled Black people, the people that are there on the forefront, how we can integrate and how we can move forward, because we have to really respect the life experience and the information from them. We need to take and use that on how we can learn from mistakes, how we can look back and take learning from it. So we really need to make sure that there's a bridge now that connects us all. That's so important for our community. We need to value cultures and identities and understandings. And to do that, we really need to be out there. We need to be visiting. We need to be speaking to people and learning and taking those experiences. And that's really powerful. And that's really how we can improve and influence the creativity and the innovation from that community. I think we need to encourage and do a Passover for generations to come. Without that, how are we going to improve? We need to take responsibility, especially through leadership, and give the opportunity back to Black innovators. It's so important to listen to those lived experiences, and only then can we really take responsibility and move on and to a different way.
Thank you, Paul. And I think what I really liked about your responses is that you actually propose a way forward and how to address the situation of that conversation between the disabled community, but also those that are part of Black Lives Matter movement. And before going to the next question, I just wanted to open the space for Crystal to respond to this question about how can the disability innovation community best support and learn from social movements such as Black Lives Matter. And I think we will appreciate your response, you being in the US and knowing what's your perspective on this.
I think one of the biggest things that people don't realize about Black Lives Matter movement is that it came out of, serious oppression and tragedy, but that other cultures joined in. I don't think that Black Lives Matter would have been able to garner the traction. Listen, Black people in America have been getting killed, ever since we got here from slavery. But I think what has happened is that as you began to get, white people and, Native Americans and Latinos, and then some people from the disability community, again, I say collective impact, coming together and supporting Black Lives Matter, that it became not just a Black thing, but a global thing for equity. And so I think that what the disability innovation community really needs to understand is how to mobilize other groups and become part of a bigger movement. I think that a lot of times we ourselves as people with disabilities limit our space. And sometimes because it's just easier, or it's what we know, or, there's the fear of stepping outside of that space. But in order for us to really make movement, demand respect, and to be able to tell our authentic stories, we have to include others. It's just like the women's movement. You have to have men involved, because right now men are still the power holders, and they have to be supportive in order to help us get through those doors. So, I once saw, I was going to an event, and it was myself, and at that time I could walk, but I had leg braces. And there was another person that had some sort of disability, and they were carrying some books, and they dropped the stuff. And an able-bodied person said, "Oh, can I help you?" And the person with the disability was like, No, I can handle this myself. Well, you know what? I said, and I say all the time, you know what? If you look at me and I'm struggling, and you ask me, do I need help? I am not going to feel less than. I am not going to have to prove to you that I could do this on my own. And I was looking at the lady struggling, and I was thinking, damn, you're really stupid. Somebody offered you help, and you want to prove that you could do it. I think that we have to be more inclusive. So those are my thoughts. My cut camera. Just short a minute. Yep, never mind.
Thank you, Crystal. And I really liked how you mentioned the importance of growing the movement and also engaging with other groups and other social movements. I think that's quite powerful. But also the phrase that you use of a global movement for equity, and how can different groups push for equity in general as well. I thought that was quite powerful as well. So I'm aware that we have a few minutes before ending the session, 5 minutes. So I'll just go to the next question. And the next question is, which have been the biggest lessons from the COVID-19 pandemic in relation to disability, race, and innovation? And Kush, I think this question will be quite good for you, considering what you mentioned before in the session of the campaigns that you've been leading.
Hi, thanks. So one of the things that it's highlighted for me, that we have to fight for our human rights, but the truth is that they're very hard won and they're very easily lost. That's something I personally learned from the COVID-19 pandemic. So we've recently discovered that the more deprived the area, the higher the mortality rate from COVID-19. So that was in the Marmot Review that was published recently. In the UK, we've seen that 3/5 of all COVID-19 deaths have been disabled people, according to the Office of National Statistics, and they equate disabled people to only be 16% of the population. We've found that people with learning disabilities aged 18 to 34 were 30 times more likely to die from COVID-19, and that's a report from Public Health England. We've seen in the health system that 63% of all health workers who died from COVID-19 are BAME, from the BAME community, whilst we actually only account for 21% of the NHS, of the workforce, and that's from the British Medical Association. And we've actually seen human rights violations upon disabled people. So the Coronavirus Act and the easements were human rights violations, suspending key provisions in the Care Act, the Children's and Family Act. We've seen that there's been do not resuscitate placed on disabled people, people with learning disabilities, with little or no consultation. So I think there's been shocking human rights violations, but it's also shown how powerful the disabled community can be when we work together to actually combat some of these human rights violations. But yeah, it's one of the things that has also really concerned me is we know that there's been a disproportionate impact upon the BAME community, a disproportionate impact upon disabled people, but there's been no research right now into the intersectional aspect and the compound discrimination of both. And I would love to see more research into intersectionality effects of COVID-19. Thank you.
Thank you, Kush. And I really can highlight that last point that you mentioned of the lack of research in the intersectionality and the COVID-19 impacts. And we've seen that as well in other regions. That is something that there's definitely a gap that we need to address from the research community. And to close the session, I just wanted to do a quick summary of the amazing points that you touch on, the importance of visibility, of growing the movement and connecting with other social movements as well, but also of highlighting the power of innovation and how the different identities, social identities in this case, and particularly race and disability, but also gender, as Crystal mentioned, can be great drivers to show the value and importance of visibility, but also of opening up spaces to discuss and campaigns to change and drive forward the impact that we want to see in the next few years. And this is the last session of the year of our Disability Innovation Live webinar series. We'll be back in January, and we will be sharing information about the next session soon. So keep in touch. Do let us know what you thought about this session. You can contact us via email or send us your views on social media. And we really enjoyed having you today. And we hope you have a good end of the year and an excellent and prosperous next year. So thank you, everyone, and we'll see you back in January.
Thank you.
Thank you. Namaskar. Thank you.
Thank you, Crystal.
Take a picture of the screen.
We'll take a picture of the screen. Say hi, everyone, if you can turn on your cameras and do a wave.
I like your Christmas tree, Crystal.
I love Christmas. I love Christmas. And it's a live tree.
Beautiful.
So I will finish this session, but again, thank you, everyone. Really fascinating discussion and a lot of food for thought for this end of the year, and amazing things that we could do to move this forward as well. Thank you, everyone.
All right.
Quickly,
Happy New Year.
before you go, Rosa, can you hear me? Perfect. As you're leaving your screen, there'll be an option to save the closed captioning, and basically you can just copy and paste all the closed captions into a Word document. It's well worth doing it. It helps putting together the transcript.